country, discussions on where we go on from here with the new US administration, with a focus on the use of AI and technology. And then finally, we will have a time to have a Q&A discussion highlighting some of the upcoming opportunities for collaboration, I beg your pardon, and next steps. So with that, I would like to briefly introduce our speakers, and I think I'll go one at a time. Our speakers are going to have 10 minutes each to share their words of wisdom with us. And I will start with Dr. Catherine Young. Dr. Young is the former assistant director at the White House Cancer Moonshot Policy and International Engagement, who has been a great leader in this effort and to extend the Cancer Moonshot globally. Dr. Young, you're welcome.
Vivian, thank you. And my immense gratitude and thanks to Will as well for bringing us all here together this morning, but also your advocacy for global cancer in general. So thank you so much. And good morning. It really is truly an honor to be before you today as we lead up to World Cancer Day, a day that really calls on each of us to reflect, to act, and to recommit ourselves to a future where cancer is no longer a death sentence, where it is no longer a disease that is fought in isolation, and where it is no longer defined by inequity. I have spent my career really at the intersection of science, policy, and global health, working to bridge the gaps between innovation and access, between government action and patient needs, and between the promise of what is possible and the urgency of what is necessary. And most recently, as Vivian mentioned, I served as the Assistant Director of Policy and International Engagement for the Biden Cancer Moonshot. I had the privilege of leading global initiatives that really reinforced a very simple but powerful truth. And that is, while cancer is incredibly complex, and I think we can all agree on that, it is also a solvable problem, but only if we choose to solve it together. What else do we know? We know that cancer knows no boundaries. It doesn't care whether you are wealthy, what zip code you live in, or what part of the world you live in. It affects every nation, every community, every family. And yet access to prevention, early detection, treatment, and care is far from equal. We know that more than 10 million lives are lost to cancer each year, many of them in places where screening, diagnostics, and treatments remain out of reach. We know that in low and middle income countries, over 70% of cancer deaths occur, often due to late diagnoses or lack of treatment options. And we know that women and children bear an unequal burden. Cervical cancer remains a leading cause of death in women, even though we have a vaccine that can eliminate it. I think it's important to remember, as we all know, that these are not just statistics. They are people. They are our mothers, our fathers, sons, and daughters. These are our loved ones, and their survival should not depend on geography and whether or not you can afford a treatment. And that is why we must be bold in science, leveraging technology, genomics, and AI to accelerate breakthroughs, bold in policy, ensuring that life-saving treatments are not just discovered, but delivered equitably, and most importantly, bold in partnerships, because governments, private industry, and civil society must come together in ways that we have never seen before. When President Biden reignited the Cancer Moonshot, he set very bold and ambitious goals. The first was to cut the cancer death rate here in the United States in half over the next 25 years, and the second to improve the experience of every person touched by cancer. But we knew that this could not be done in silos. We needed global partnerships, innovative approaches, and a commitment to equity. And here's what that looked like in action. For the first time, the United States, Australia, India, and Japan came together under the Quad Cancer Moonshot Partnership to tackle cervical cancer in the Indo-Pacific, one of the deadliest, most preventable cancers. We launched an initiative with $2.2 billion in funding and commitments to deliver over 40 million doses of the HPV vaccine prioritizing adolescent girls in underserved regions, to screen at least 5 million women through expanded access to self-collection HPV tests, and to strengthen treatment options by expanding access to radiotherapy and surgical care in low-resource areas. This is a model for what global collaboration can do, not just for cervical cancer, but for other preventable cancers that disproportionately impact low and middle income countries. For too long, cancer has also been neglected in global health efforts, treated more as an afterthought to infectious diseases. But at the White House, we convened the first ever Africa Cancer Care Forum, recognizing that if we are serious about global health, we must prioritize cancer care across the continent. This convening brought together African health ministers, US agencies, multilateral organizations, and private sector partners to define urgent cancer priorities. We mobilized over $100 million in new investments from governments and private sector partners to expand cancer screening, workforce training, and treatment infrastructure. This brought our total to over $400 million in funding and commitments during our time at the Biden Cancer Moonshot to reduce the burden of cancer in Africa. And this is just the beginning, but it signals a new era built on the shoulders of so many of you as part of a new global cancer action. One of the most promising developments in cancer diplomacy was the US-India Cancer Dialogue, which brought together two of the world's most innovative health and research ecosystems to tackle cancer in new ways. Through this partnership, we accelerated collaborations between the National Cancer Institute and India's Department of Biotechnology, creating new opportunities for joint research on cancer prevention, early detection, and treatment. We expanded efforts to scale affordable and accessible cancer screening technologies, ensuring that millions more, particularly in rural communities, can detect cancer earlier when it is most treatable. And we prioritized workforce training and capacity building, recognizing that India's vast health infrastructure can be leveraged to develop scalable models that benefit not just one country, but the entire world. The US-India Cancer Dialogue is proof that when two nations with world-class research institutions come together, the impact extends far beyond their borders. It is a model for how bilateral partnerships can drive global progress, and it is a testament to the power of science diplomacy. And lastly, one of our most significant efforts we initiated was the discussion around a global cancer fund, modeled after the success of other global funds like PEPFAR and the Global Fund to Fight AIDS, TB, and malaria. Cancer is a long-term challenge, and short-term fragmented investments will never be enough. This fund would create a sustainable financing mechanism to help low and middle income countries expand healthcare infrastructure and capacity, leverage AI and the latest technologies in screening and detection, and ensure treatments are accessible to all. It would harness public and private sector commitments, driving a new level of coordination between global governments, nonprofits, and the private sector. At the White House convening, we saw a clear mandate for action because if we want to make cancer truly global, or cancer care, I should say, we must also make its financing sustainable. All of this work, from the Quad Cancer Moonshot to the Africa Cancer Care Forum, from the US-India Cancer Dialogue to the Global Cancer Fund, represents a shift. Cancer is no longer just a scientific challenge. It is a political, economical, and social imperative. But let me be clear, progress is not inevitable. It happens because people like you refuse to accept the status quo. It happens because we push harder, we speak louder, and we demand more from ourselves and from those in power. Each of us has a role to play. Researchers to push the boundaries of what is possible, advocates to amplify the voices of those fighting to be heard, policymakers to ensure that equity is not an afterthought, but a starting point, industry leaders to drive innovation with access and affordability at its core, and patients and survivors, the heartbeat of our work. Continue sharing your stories because they shape policies, they inspire action, and they remind us why we do this work. I want to leave you with a thought. There will come a day when we gather not to discuss the fight against cancer, but to celebrate the fact that we overcame it. That future is not a dream, it is a choice. It is a choice to invest, to innovate, and to include everyone in the progress we make. World Cancer Day this Wednesday, let us not just recognize the urgency of this fight, but let us commit to finishing it, because a world without cancer is not only possible, but it is within our reach. And with that, Will, Vivian, I will turn it back to you. Thank you.
Thank you so much, Dr. Catherine Young. We are incredibly, incredibly honored to have you as part of this family. It's been such a journey, and we continue to embrace your wisdom, your partnership, your collaboration, and thank you for your presentation. Now, our next speaker is the amazing Professor Hedy Risak, who is the professor of the Memorial Sloan Kettering Cancer Center and a co-chair of the Lancet Oncology Commissions, among so many other things. Like I said, I will not do justice to their introduction. So many awards, so many medals. But Dr. Hedy, Professor Hedy, over to you.
Thank you. Thank you, Vivian. I apologize for my voice. The host is, I'm trying to share, but it's not oh, now it's working. Sorry. Okay. Thank you. Let me just 1 minute. Catherine, this was fantastic. And it's difficult to follow you. I'll do my best. And that is, with this voice, speak on the ongoing initiatives and the importance of building the workforce. So we all know that, as Catherine said, cancer is our problem, but the problem is growing. And it's growing. That prediction for 2050, when President Biden said that we're going to cut the mortality in half, there will be 77% increase in cancer cases. What is really worrisome, 142% of that increase will be in the low HDI countries, or low middle income countries, where already the cancer mortality surpasses mortality from HIV, malaria, and TB combined. So the problem is huge. Cancer and our planet, we need to reduce cancer deaths. And only way to do that is by scaling diagnostic, treatment, quality of care, and harnessing AI and computer analytics. So steps we need to take: infrastructure, energy. We have to have sustainable energy, medical equipment. But we're going to focus on workforce. Cancer care is a multidisciplinary team effort and involves from physician to community workers. And then, I really apologize, patient access. So the projected workforce shortage for 2013 will be 18 million by WHO. In Africa alone, the projected shortage is 6.1 million. As reported by WHO, 80% of population in low middle income country has no access to trained oncology providers. And just this single slide really shows why we need to get together and make a difference. This is for in my own specialty. We cannot no longer show slides where in large part of Africa, colored in yellow, there are less than 9.9 radiologists per 1 million inhabitants, or for nuclear medicine, colored yellow, which is very few, is actually less than 5. And most of them, there are not even data available, or colored in dark gray. Those countries have not a single nuclear medicine trained physician. And that was recent data from IAEO IAEA published in Lancet Oncology in 2024. Everybody is now speaking about nuclear medicine, but how can we implement nuclear medicine studies when big part of the world has no nuclear medicine technologists? There are colored in yellow are less than 10, and there are a number of countries that don't have a single technologist. We all want to implement radiotheranostics, targeted therapy, but there are countries and countries in Africa, also in Asia. We can just look at Afghanistan and others that are dark gray. They don't have a single radiochemist or radiopharmacist. So the workforce shortage is tremendous. But if we don't do anything, our cancer deaths in about 10 years will be 76 million. But if we scale up treatment, we can avert that 12.5% of deaths worldwide. That is globally. If we invest the same way in Africa, we can avert 35.7% of cancer deaths. And today, cancer mortality to incidence ratio is more than twice higher for sub-Saharan Africa than it is for the high-income countries. We're really, being just human, cannot tolerate such huge differences in cancer survival for the same cancer, the same stage. Return on investment is tremendous. As Catherine said, the Global Fund, we just need to show them that for every dollar invested globally, return on investment is $12.45. But if you invest in Africa, that return on investment is $21.39. So a huge 1 to 21. We need, this is for our policymakers, why they need to invest in Africa and low middle income countries. We saw 6.1 million shortage. So obviously we need to pay attention to education, equally important to retention, and then the use and implementation of AI. With what we call 2025 human-centric digital transformation. You know, we now talk about artificial intelligence as it was invented yesterday, but it is 70 years old. John McCartney coined the term artificial intelligence in 1955. So the technology has advanced, and now we have to look at different problems, such as there are many that fear that AI, the patients will not accept. However, as published in Nature, January 2024, Google AI has better bedside manners than human doctors and makes better diagnosis. Published in JAMA Open Network November last year, large language model, which is generative AI alone, demonstrated higher diagnostic performance than physicians groups. And it really indicates the need for technology and workforce development to realize the potential of physician artificial intelligence collaboration in clinical practice. And it is, in my opinion, the only way that we can solve the healthcare workforce shortage around the world. And then there is agentic AI. We really need that. We need that to replace, not replace, but to augment of the workflow design, education, and workflow optimization. It works, it has been shown, and we should remove the fear. But then we also need to address patient access. if we do all of this, we have equipment, we have physicians, but patients need access. And I am very happy to announce, and Will is a part of our team, that we are putting forward the resolution on strengthening the imaging capacity. Hugely proud for the Ministry of Health of Cameroon that are leading this initiative. And actually next week in Geneva, there will be first voting, and we certainly hope that it will pass. So we have great hopes. They are not dreams, they are reality. And it's as it always seems impossible till it's done. And I think all together we can do it. So thank you very much.
That is incredible, Professor Risak. It's always such a joy to just hear you speak, because you provide us with statistics and data, and there is no intervention that is more impactful without data. So thank you again for being a part of the GHC, the collaboration, the oncology participation. So we will build on to that later, but our next speaker is Dr. Beatrice Adai, who I like in my own way to call a mother to many of us in Africa, because she's the CEO of Peace and Love Hospitals, president and founder for Breast Cancer International. So she takes care of any of us women with breasts. And with that, I'll just like to hand it over to Dr. Adai.
Thank you so much. Just give me a few minutes so I share the slides properly. Good morning, good afternoon, good evening. And I must say, I'm extremely grateful to be invited to speak on this very important topic. The cancer moonshot has gone global. What's next? And as we prepare to celebrate the World Cancer Day on the 4th of February with the theme, United by Unique, and also focusing on people-centered cancer care, I deem it an honor to be a part of this pre-summit webinar for the Global Health Catalyst. My name is Dr. Beatrice Adai, as you heard. I'm indeed honored to represent those of us in the low and middle income countries, appreciating the Cancer Moonshot and President Biden for extending the Cancer Moonshot globally, as Dr. Kathleen Young had shared, and especially put on notice that many presidents, both Democrats and Republicans, have supported work on cancer and other diseases, as President Bush did with PEPFAR. And this is rightly so, because cancers do not discriminate. But we are grateful for the support, for the research and innovation so far, which has helped in saving the lives of our vulnerable women, men, and children especially. I wish to highly acknowledge the work of the Global Health Catalyst team and the engagement with the White House in the effort of extending the Cancer Moonshot globally and facilitating support for the Otumfuo Osei Tutu II Comprehensive Cancer Center of Excellence in Ghana. It's the first of its kind, the first standalone one-stop shop cancer center of excellence, which includes an AI hub. And so you see the team, the patrons and the team who have been working tirelessly. I bring you warm royal greetings from His Royal Majesty Otumfuo Osei Tutu II, the King of the Ashanti Kingdom, and our president, our former president, President John Adjei Kufuor, who is also a patron to us. A 52-acre plot of land has been dedicated to this comprehensive cancer center of excellence. and we decided to phase them. And so the first phase of the center is estimated to cost about $10 million US. The core aspects of the center are prevention and awareness, screening, research, training and education, diagnostics, pathology, surgery, chemotherapy, radiotherapy, immunotherapy, palliative care and rehab, survivorship, and an AI hub. I'm happy that my predecessors have mentioned all these efforts that is happening and the importance of its growing global. So indeed, the Cancer Moonshot has gone global, and its positive effects in the low and middle income countries like Ghana happened last year in October when we had a groundbreaking event where scientists and researchers joined us in Ghana to break the grounds for the first ever comprehensive cancer center of excellence. The Lancet Oncology Commission's report on Sub-Saharan Africa, which was put together in 2022, actually was the catalyst to this kind of event. The CCCOE, that is the Comprehensive Cancer Center of Excellence, emerged from the Lancet Oncology Commission's report, which recommended building win-win international partnerships between low and middle-income countries and other countries like the US to address the growing cancer crisis in sub-Saharan Africa. Breast cancer is the leading cancer, and cervical cancer is a leading cause of death, which the Cancer Moonshot has rightly identified as a priority. Let me quote from the Lancet Oncology report. We have seen too many reports, too many words, too many good intentions, too many families torn apart, and too many excruciatingly painful deaths to see yet more delays in taking collective action to accelerate cancer control in sub-Saharan Africa, end of quote. So during the launch of this report, this very important report, we had very important personalities joining us. The picture at the upper right happens to be our first female vice president of Ghana, Professor Nana Opoku-Agyeman, who was there during the launch to support us. The president of the National House of Chiefs was there, our former First Lady, our former health minister, the former health minister of Nigeria, 3 lead commissioners, Professor David Kerr, Professor Will Ngwa, who was the chair, and Dr. Beatrice Yafiada were the 3 lead commissioners. We also had 51 more commissioners, 50% from Africa and 50% from the diaspora. 50% were women and 50% were men. We also had the chief editor of the Lancet Oncology Commission, Professor David Collingridge, coming himself to join us. The picture below is our chief of staff, who was sworn in just recently, and they were all there to support this effort. After that, we met with hundreds of breast cancer survivors at the Peace and Love Hospital, and here we can see the efforts of Professor David Kerr. You know, it was fun, it was nice to see women who have survived breast cancer in Ghana. One of the areas for the CCCOE win-win collaborations with the US will be the Comprehensive Cancer Center in the Cloud, the C4, powered by AI as we invest in the future. We in the CCCOE Ghana recognize this also as a major area of collaboration with the new US government's interest and focus on AI, as seen with President Trump's recent announcement of Stargate, where a proposed $500 billion AI cure for cancer has been made. We are extremely eager to be considered in this timely and demand-driven initiative. According to Prof. Ingwa and the team, the C4 is a multi-institutional interdisciplinary collaboration whose inception was catalyzed by the summit, the Global Health Summit. It's a multi-level, community-oriented, patient-empowering health platform that brings together medical institutions, spiritual leaders, Black and indigenous communities, people of color, and educators to collaborate towards achieving health equality. With the support of such technologies like artificial intelligence, we know that this initiative will improve access and quality of care, especially to the underserved communities. And I mean, to those of us in the low and middle income countries, and to bring healthcare to communities instead of waiting for people to come to the medical centers with late stage diseases. I wish to thank leaders like Professor Hedi, Dr. Ketri Young, Professor Will Ungwa, the entire Global Health Catalyst team, and all the people who put together the Lancet Oncology Commission's report, the board of directors, patrons, advisory committee members of the CCCOE in Ghana for championing the extension of the Cancer Moonshot globally. Please, the work still continues. So I look forward to continuing collaboration and growing new partnerships during the next Global Health Catalyst Summit at Harvard, MIT. I humbly welcome your support as we work with the Global Health Catalyst and partner institutions in the US and elsewhere to make this life-saving project a reality as soon as possible. We don't have enough time to wait. Thank you for giving us the helping hand all this while. But with AI and innovations, we may not need to hold hands physically, but we can still be able to leapfrog and support each other more than ever before. I thank you so much for inviting me to speak. Thank you.
Thank you, Dr. Adai. It's always a pleasure to hear you speak, to get insights in the work that you're doing in Ghana. Thank you for representing low and middle income countries. And to all the speakers, again, I say thank you, but I want to hand it over to Dr. Ngwa before the Q&A session.
Oh, wow. I mean, this is really powerful. I mean, I was so excited just to hear all the three speakers. It's just been amazing, really powerful, you know, from you, Catherine, your leadership in the Cancer Moonshot, extending that globally. That is just phenomenal. I know, you know, just really looking at ways as we think about going forward, how we can pick your brains more and really get you to help continue to lead us into the future, how we get this forward. And Hedy, oh man, your numbers are always just like the most amazing. You know, you make us know why, you know, we need to do these things. You know, think about that. I remember the one of those numbers, you know, $1 investment with a return of $12, and for Africa, 20-something dollars. I mean, who doesn't want that deal? Right? Who doesn't want that deal? But you are so amazing because you always make this really real, you know. And I still remember when we launched the Lancet Oncology Commission in Nigeria, one of the things they said was, you know, Nigeria is going to lose $5.6 billion per year because of cancer. And that was what the politicians picked up. They didn't pick up necessarily that, you know, people are dying, you know. So that was one of the things they picked up. So thank you. And then Beatrice, I mean, you paint the future for us, right? You paint the future for us. Building a regional comprehensive cancer center of excellence in Ghana, that is such a huge endeavor. And we just want you an amazing leader. Obviously, you're already world-renowned for your breast cancer efforts. But, you know, that's the future now in this cancer center. And I think we are all here to support you, as you said at the end, you know, to really make that a reality. But I wanted to just share, you know, before we move to Q&A and really have everybody, you know, be able to participate. And please type questions in the chat or in the Q&A. I just wanted to point out that, like Hedy said, even with AI is not totally new. I mean, this is something that has happened for, it's been there for a while. I mean, we are now at the time when it's really kind of broken through. But also cancer, really, there's the legacy of historical legacy. Cancer, like Catherine mentioned, doesn't really affect, it doesn't matter where you are from, your zip code, what your color of your skin, so this is something that's really a unity agenda. And we most, like the World Cancer Day is saying, we really have to kind of unite here to do something. So I just wanted to show this chart, just showing in 1971, President Richard Nixon declared a war on cancer. That launched the National Cancer Institute the way it is today. It's been amazing progress, obviously. And then with President Biden really kind of launching this cancer moonshot, the impact of which has been shared by Catherine. It's just the work continues. I saw the last posting from the moonshot talking about how that work continues even into the private sector right now. All of us can still do something. But, even with the Global Cancer Fund that Catherine is still mobilizing and leading around, I think that that's something that, we all can come together to use some of those dollars to invest and get that big return on investment that Hedy has talked about. And then, amazingly, the GHC, when the first launching at Harvard in 2015, I still remember the first paper that was published out of that was the use of information and communication technologies to overcome geographic barriers in global health. And now 10 years ahead, we are talking about AI and technology, and it was really exciting to see President Trump launch, the Stargate. There are still questions about, how this is figuring that out. But, one of the key things they highlighted was working towards a cure for cancer. So this is really something that we all are united around. And, really, this is an opportunity for us as to think about the future that we are going to work with this, with the Trump administration, building the progress on the cancer moonshot, and really making sure that this future we all can do something about in a united way. So I just wanted to highlight this to kind of say, this is really the theme of all of us really coming together. If together we can build a legacy of hope and progress against cancer. So I'm going to hand back to Vivian to moderate the Q&A, in the chat. Please type questions in the chat. We have these amazing speakers still waiting for you guys to interact.
Thank you so much, Dr. Ngwa, for that kind of recap of where we are and where we were before as a country, where we are and where we're going. And, with that, I just want us to, for those who have questions, please type them in the Q&A so that we can extract them from there and pass them on to our eloquent panelists who have given us so much information. Just one second as I read. We have a question. What advice do you have for medical graduate students wanting to get more involved in global oncology outreach? And I think we'll give a couple minutes to each of you to just speak to that, starting with Dr. Young. Oh, I think you're muted.
How about now?
Perfect.
Perfect. I'll just take them out. It seems like maybe that question came from Elizabeth. And I think you are doing everything already by being a part of this webinar today and kind of identifying the individuals and organizations that are very enmeshed in ensuring that global cancer is propelled forward. So my advice would be to make contact with any of us here on this panel. We are very available, especially on platforms like LinkedIn. I'm, of course, always happy to have conversations with anybody, but certainly I think there are many opportunities for people who are brimming with excitement to get involved in the global cancer community fight. So please always reach out and have conversations, because I think you will find any of us willing to have those conversations.
Oh, thank you, Dr. Young. Next, Dr. Risak, Professor.
Hi, just Hedy is perfect. So I just to add what Catherine said, and that is you should get involved with the societies. I don't know exactly where you are or your institution. Many institutions, sorry, this is called a post-viral cough, but it's not going away. Many institutions, let's say Harvard, they all have a very well-organized and powerful global health. Alone, I think it's much better if you are part of an organization or an effort that's organized, and not just going alone. It takes a village, and the village has to stay together. So you just find your peers, find your institution, call Will for the Global Catalyst or Beatrice. We all want to see people that are going to, so we make a team.
Awesome. And Dr. Adai?
Yes, so I just want to say that from the discussions, you realize we don't have enough healthcare professionals. So our doors are open. If you are in the high-income country, you want somewhere to go for your attachment or to volunteer, we are there. We need people to work with. So we are always there. Contact us. And if it's your summer holidays you want to use, or whichever area you want to focus on, we will embrace you. Please come and let's work together. We have enough work for everybody. Thank you.
Thank you so much, Dr. Ajay. And the other question we have is from Ari, who is with Kids Fighting Cancer. They're our lovely young cuddlists. So he says, what are some of the important topics we should focus on as we work to educate young people about cancer? And I think we'll go through the same cycle. Dr. Young, Dr. Risak, and Dr. Dai.
Hi, Ari, and thank you for all the work that you're doing. I think this is a really important question, especially as we think about how to engage our future generations into not only the work, but also ensuring that they live healthy and as full of potential lives as they possibly can. I think there are two things that come, well, really one big one, and that is prevention. So we should and do everything that we can do to educate our younger generations about prevention and cancer. And I think that underneath the HP is a critical area that our youth should become well informed and educated about. But I'll just be brief. I think the prevention part for me, I think, is a really critical conversation to start having with our operations.
Vivian, shall I start?
Yes,
Is there a
yes,
problem?
Dr. Risak.
Okay, sure. I just would like to continue on prevention. We know that recently, not only in the United States, but all over the world, there has been increase in cancer incidence among young people. And while we don't know exactly why, we do know, and it was published by AACR, which we all look up for research, 70%, 70, of cancer incidents can be avoided by lifestyle, which means, number one, there is tobacco, there is obesity, and then there is alcohol, which hopefully we're now doing something about. And then there are preventable disease that use of for infection, and there is physical activity. Our children today sit on the iPads and computers for too long. So there is a lot in education of young people, a lot. That's actually shouldn't cost that much money. It starts at home, starts in your school, and it really, if we are serious about, we can really prevent that. And I don't know what to do with college drinking, ban drinking in the United States, but we know now it is one of the huge problems.
Dr. Adai.
So I want to say that if, for example, we need to fight cancer the way we should, then we should try and prioritize cancers, because it's more efforts on the communicable diseases as against the non-communicable diseases. But we've come to the realization that the non-communicable diseases will always be with us. We can be done with HIV/AIDS, tuberculosis, malaria, but the NCDs will be with us, and cancers are part of that. We should also focus a lot of attention on education and awareness creation, because if the parent even knows nothing about cancers, how can they think about the child who is having some signs and symptoms of a cancer? So the education should not be for only the healthcare professionals, even though that is also very important, especially those in the primary healthcare sector, where they see patients early before referring them. We should try and retrain them, and also train or increase the awareness among the populace, both adults and children. We should focus a lot on the youth, the students, because that will help them to grow with the knowledge and also help them to dispel the myths and the misconceptions surrounding cancers in the low and middle income countries. As we speak, a lot of people think cancers are caused by witchcraft or it's a spiritual disease. And so instead of going to the hospital, they will go to the prayer camp, or they will go and apply some traditional herbs. So we need to intensify education and awareness creation. We shouldn't be tired of it. And also let people understand that cancers are survivable. Cancers are curable, but only when they report early. If we all put in the effort, bringing in all the stakeholders, including our governments, for them to also put in more effort on what can be done. I think if we do this, we will move somewhere. Thank you.
Thank you so much. We've had a flood of questions, both in the chat and the Q&A. So I'm going to try, in the interest of time, I'm just going to try to merge some of the themes from these questions, and then we'll see how best we can get them together. So some of the themes that I've picked up is, one, people are wondering what the new administration is going to look like in terms of implementing the priorities that we have been, we've had at the center of the cancer moonshot. So what would that look like, or what do we envision that to look like? And in the same context about in relation to the new administration is what is the status of the Global Cancer Fund? And so we'll start maybe with the status of the Global Cancer Fund, and then transition into what the new priorities for cancer might look like with the new administration, starting with Dr. Young.
Let's start with the easy question first, is what you're saying. I think, listen, very excited about the Global Cancer Fund. We have now convened stakeholders who are incredibly committed to seeing this work continue going forward. The very final day of my day at the White House was we convened for the last time a meeting to ensure that there were very, very committed people taking this forward. So I can tell you with great enthusiasm that this work is moving forward and will continue regardless of the stance of the United States government. I think this is a truly global and united effort to see this launched. Vivian, do you want me to address the second one, or should we come back to
Yes,
that one?
please.
Okay, the second one.
And then transition us to that.
So obviously, as we've heard here today, cancer is a highly supported topic, regardless of which administration comes in. It is also here in the United States a very bipartisan issue. So I am very much assuming that we will continue to see the support that we have been seeing with the Cancer Moonshot. One of the strategies that we used in the White House with the Cancer Moonshot was to ensure that the work was embedded into the agencies that were executing the work, and that those funding lines were going to be taken forward for many years to come. And so I think you will see that the work, even though it may look different, even though we might not have a Cancer Moonshot per se in the White House, it doesn't matter. That work will continue regardless. And we know here on our screen with Will working at his agency, I mean, there's no doubt this work will continue from my perspective. It may look just a little bit different, but I will stop there.
Thank you. Perhaps Dr. Hede, could you speak to what that would look like in terms of pushing the work of the commission going forward?
So I like hearing from Catherine that it will continue. So that's nice. I think for the Global Cancer Fund, we should ask Will. Our commission, we are working on, so there was a question, are the data that I have shown been published? Everything has been published, and it has been published in Lancet Oncology Commission on imaging and nuclear medicine, or in last year, Lancet Oncology Commission on radiation therapy and theranostics. So we wouldn't show data, especially economic data, unless they have been published. So everything was published. So Kate, what are we doing next? We are now working on the Lancet Commission on Workforce. And as Beatrice and Will know, we are going to address all specialties. We are really trying to understand, with help of the global community, that while cancer care is a team effort, that team looks different in different parts of the world. Community workers are extremely important. So we are really looking at all subspecialties. And I have to tell you that those data that we are going to have, hopefully, we have to finish by September 2025. Will address every specialty in oncology, and it has never, ever been done before. So we definitely need a baseline to know how to move forward. We need to know where are the bottlenecks. And Will and I are going to make sure that people are no longer afraid of AI for the workforce. Now, the human touch is very important. I think community workers, Beatrice even says people that go to church and the ministry are important, very important. But this thing that it all depends on a physician, it doesn't. So that's the culture we hope to change with the new commission.
So watching from afar, I would want to say that we haven't given up. It's so good to hear that the Cancer Moonshot Fund is going private. It means it's still there. We're going to tap into it. And also we hear from the new government that the Spargate, there's something there also. And we are talking about AI. Let's see how we can also benefit. It's probably going to be synergistic so that we get from here, we get from there. Cancers do not discriminate. So let us keep our focus. Let us still keep the hope high that we will be able to do something, irrespective of who is where.
No,
Thank you.
Thank you so much, So there are some questions, but I think this is a great time to say that there are going to be more webinars. And I'm going to invite Dr. Will to talk about that very shortly. But there's been questions about shortage of the workforce, physician workforce. So I'm just mentioning this to recognize that we have seen the questions, but we've run out of time, unfortunately. And there was a question about the ROI, the ROI. So we're going to capture all these questions and make sure that we can integrate them in the upcoming webinars. So please make sure you look out for those webinars and come and continue this conversation. This is just the start. We're not going anywhere. So with that, I want to say thank you again to the panelists and hand it over to Dr. Ngwa to wrap us up as we get to the top of the hour. Thank you so much.
Yeah, thank you, Vivian. I mean, I think, we can probably go on this for hours, right? Like, I mean, there's just so much enthusiasm. First of all, just thanking all those who have joined today. This was a really short notice. I mean, this kind of 2 weeks ago, kind of thought, okay, we're going to start something like this. But like Vivian said, this is just the start. We've had this, first of all, I mean, let's just applaud for our all-star females panelists, right? It's amazing, and these are all champions. Like each one of you on this panel is just remarkable, right? I mean, we just thank you for all the work that you've been doing on the global oncology space, and they are not going away. They are going to be part of this continuing conversation. And as we move towards the mentioned World Cancer Day, it's really kind of highlighting that we can all, if you're on this chart today, you can definitely do something, right? So the next webinar is going to be on the 15th, 2 weeks from now, and talk about technology. Hold on to those questions. Like that is a big opportunity for you to bring those questions. So one of the big things that we're going to be really showing a united front, whether it's from the Cancer Moonshot or the new administration's focus on technology, is this idea, and we've discussed this, with Catherine as well, even thinking about when you talk to ministers of health, they are telling you, this is the way they want to go. If you invest in technology, you can address cervical cancer, you can address breast cancer. They don't have to worry about, you can extend that to tuberculosis, malaria, even agriculture, right? So, next seminar, we're going to talk about, this big vision of establishing a comprehensive cancer center in the cloud. A number of you that are on this call today are actually really working hard towards this. And so that's going to be next on the webinar. We're going to talk about or keep all your technology questions. I like Hedy because she's amazing. It's our AI person, talking about how the technology and AI and how that's the impact on the workforce as she works on this commission. That's one of the things she's been doing. But yeah, so that's going to be what we'll cover in the next 2 weeks. So want to welcome everybody back. By then I think we actually have a more longer space now to invite more people to participate in the discussion. I will just end with one of the questions, just adding to what Catherine said. What is the impact of the new administration? I think, the unity agenda as we go forward, it's clear that cancer, I showed in that graph, Nixon was a Republican president, Biden, Obama, you can go down Bush, like Beatrice said, was PEPFAR, biggest global health program ever. So the thing is that healthcare affects us all, and so, people are anxious about some of the communications that have come out, but I think giving the US administration some time to onboard, so there may be some delays in some things, but, definitely we are all united in this action around healthcare. So that's where I would end, and I would say, thank you so much. Let's thank the panelists again, and thank you all for participating, and look forward to seeing you in 2 weeks.
Thank you.
Thank you.
Thank you all. Thank you.
Thank
Bye.
you.
Bye.
Bye-bye.
Great job, Vivian. Fantastic.
Great job.
Job, Will. Awesome. Great.